I want to thank Margaret, Diane, and VJ for inviting me. Can we give them a round of applause also? Sometimes we forget the organizing people that put in all the work. Well, I have the privilege of going around the country and the world to talk about the future of AI in healthcare. And it's so nice to be back at home in Orange County in front of a home crowd. Not that the other crowds aren't friendly, but it's just a special meeting, so thank you for having me. But when I came home a couple of nights ago, I decided after work to go to one of my favorite Chinese restaurants to have a late dinner around 7 o'clock. And I walked into the restaurant in Irvine, not far from here, and I was other than one table of 2 students wearing masks, I was the only other customer. And the restaurant owner came over and said, "Oh, hi, Dr. Chang, welcome back home." And I said, what's going on? It didn't occur to me that Irvine was hit with this whole issue with COVID-19. And he said, well, it's been quiet all week, well, actually 2 weeks. And he said, he knows I'm interested in AI. He said, well, how would AI change all of this? I said, for one thing, if we had AI at the level that we needed, your restaurant would be full tonight. So I think it's amazing how humans, I think without the adequate coupling of technology, can really, really impact on health and disease. So I was asked to talk about artificial intelligence and in terms of impact on providers, payers, and patients, and maybe the highlights and what's going on in healthcare, and some ethics and bias discussions. And oh, by the way, you have 20 minutes. So I just don't know what to do with the rest of the 20 minutes. So, okay. So, all right. So I'm going to do a quick survey here. So what do you think about future number of humans in healthcare? We heard about the economics and a lot of inefficiencies. So you have 3 choices. So how many people think the number of humans in healthcare would decrease in the next decade? Okay, just a few. How many think it's about the same? So the rest of you, I'm assuming, think it's going to increase, despite what we just heard about? Okay. So artificial intelligence is all around us. Last year was a landmark year. There were more stock market transactions that were done by machine intelligence than human intelligence. It's very common for professional sports teams, especially ones that have a lot of capital invested, to actually have a data science team, not just a data scientist on the team, to figure out trends and tendencies for opposing teams. And I spent a lot of time at airports, and you can see on the shelves now plenty of focused efforts to talk about artificial intelligence. So also just to get an audience response here for your tolerance for automation or artificial intelligence, how many people here would be very comfortable sitting in an entire autonomous driven vehicle, steering wheel and brake? Okay, so this is a very progressive group. How about, I say that because some people you would ask, including the brakes, how about an autonomous flying vehicle? All right, a lot less. How about an MRI entirely from start to finish, including interpretation without human radiologists? Okay, this is a surprise to me. Okay.
Including a radiologist.
That's right. So I'm happy to say that artificial intelligence has, officially lifted off. We're still in orbit around the Earth. We just need a moonshot for medicine, and I'll talk about that in a few minutes. So why now? Well, 3 things came together in the last decade. And by the way, I agree that the next couple of decades, if we work for it, will be the most advanced in the history of healthcare and medicine if we put our minds and really work at this. The advance in algorithms out of principally Canada from early 2000s to 2012, the availability of cloud computing where we can store a lot of data, and the third is, thanks to our gaming industry, GPUs. GPUs with fast parallel computing. And lastly, more healthcare data has been synthesized in the last 3 to 5 years than the history of medicine. So the availability of data, granted that it's not as organized and cohesive as we would like, but the wealth of healthcare data is definitely, I think, a huge incentive for us to get good at this. So right now, we are at current state of AI. It's very good at narrow tasks, like the autonomous driven vehicle, like playing the game Go and beating human champions, but still very relatively narrow focused. In the next decade or two, we're going to start seeing machine intelligence starting to behave more like humans in terms of cognition. And that's the exciting part for clinicians and stakeholders in healthcare. I know Tom briefly discussed this, but just to reemphasize that not all AI is the same. There are actually 3 very important categories to remember. One is assisted. Think about the iRoomba vacuum cleaner. In healthcare, think about robots that are now more and more pervasive in healthcare. You can walk in some hospitals and the entire blood testing lab is now without humans. Augmented is getting a lot of discussion because that's exemplified by Watson for oncology, despite the negative publicity recently for lack of the success that we anticipated. I think it's going to make a huge comeback. That wasn't a stock tip. I'm just saying human cognition is going to make a huge comeback this decade because that's what we need to put AI at a different level. And autonomous mode of artificial intelligence is scary for some people, and I think that's partly appropriate. I often get asked the question, what if machines are doing things on their own and we humans are not involved? And that's going to be very scary someday. Well, guess what? It's already here. There are autonomous devices. One is an ophthalmology retinal image interpretation software that is now without and doesn't need human interpretation because it was sort of curated by humans and is now operational at the University of Iowa. So you can imagine the global health implications of having these wonderful tools available in places that don't have access to ophthalmologists. So there's a lot of confusion about what words mean in general around artificial intelligence. I thought this slide is helpful to basically say that deep learning and machine learning are under the umbrella or domain of artificial intelligence. And data science mathematics are kind of converging with artificial intelligence to become, I think, one overall science. Someone challenged me one time to put artificial intelligence on one slide. So here it is. But you can see, once you start understanding the portfolio of tools that are available under artificial intelligence, almost every single one here has really impactful contribution to healthcare and medicine. It's just that I think healthcare and medicine is relatively virgin to artificial intelligence. So a wonderful decade or two coming up in terms of accomplishments, I think, are going to be in healthcare with artificial intelligence. I think perhaps next to education, healthcare might be the slowest sector to adopt artificial intelligence, which means I think the opportunity is really nothing short of grand in the next decade or two. We talk about Watson and what it is, and Watson is a good example of what we call cognitive computing, which is, think of the entire portfolio I just showed you as a full symphony orchestra, and think of IBM Watson and cognitive computing as a small string ensemble. It's basically a few tools. It's not the entire portfolio, but it's really, really come a long ways in the last couple of decades, and you saw that during the Jeopardy game in 2011. Something that I think Emad mentioned briefly in terms of natural language processing, this, I think, aspect of artificial intelligence, I'm projecting, since we're at a futures conference, will have even more impact than deep learning that we're seeing now. I think it's vastly under-leveraged in healthcare, but it has, I think, a high level of impact once we have computers and clinicians and nurses understand each other in terms of how we communicate. I think medical records will be in a totally different quality as well as exchanging information, as the previous speakers have discussed. So natural language processing, if you don't know it, don't understand it, as a healthcare leader, I think you really need to start understanding it because it has huge impact potential in the next decade. I think another aspect of artificial intelligence is actually resurgence of something that's relatively primitive. So robotic process automation is getting some discussion. It's actually been around for about 4 or 5 decades. It's a primitive algorithm that can drive a lot of the processes in healthcare that ought to be automated. I heard a recent statistic that was kind of sobering. In the last, I think, couple of decades, the number of clinicians, people that deliver care, has increased 100%. But does anyone venture a guess in terms of number of people involved in administration, including payers? What percent has that gone? I don't know if that was discussed yesterday, but it's 3,300%, 3,300%. So 33-fold increase compared to clinicians in terms of delivering care. So obviously, there's a lot of administrative burden that can be relieved by artificial intelligence. So I think to put all of this on one slide, we've had evidence-based medicine for the last 3 or 4 decades. In order for us to deliver precision medicine, population health, and administration at a very, very efficient level, there's this huge gap in data information that we need to capture and make sense out of. So that's what I call intelligence-based medicine. Another way of looking at this is look at evidence-based medicine in terms of data and information as what's above the surface for an iceberg, and 90-95% is actually underneath the surface. So that's, again, intelligence-based medicine includes administration, includes everything that we do in healthcare, period. So I think, basically in healthcare, we're practicing healthcare and delivering healthcare in a matter of months and years when the world has gone to seconds and minutes. So you can see the disconnect. I used to show this cartoon as a joke, but that's actually becoming true. That you may not be replaced by a robot, but you're going to be replaced by someone who understands robots. A couple of months ago, I saw an ad by Department of Radiology that's advertising for a radiologist with a computer vision background. So, and I think that's going to be a trend. And I actually had a public debate with an AI guru in Silicon Valley about, and he was espousing that the number of radiologists will go way down. And I actually said it will go way up, because with the complexity of images and making radiology a lot more attractive for some physicians, I actually think the number of radiologists go up, not come down. So we'll see who's right within this decade. So just to highlight in terms of the 3 main areas in healthcare with application of AI that already has some track record. One is the surgeon support and hospital monitoring. You probably have heard or seen this article from the New England Journal about the use of the Apple Watch for identifying atrial fibrillation. I think we still have a long ways to go in terms of adequate analytics to make the diagnosis. I get lots of false positives from my patients who wear this watch. But I think it's going to get better very, very quickly. At our hospital, Children's Hospital Orange County, we actually have real-time analytics in our cardiac unit, so you can actually give the clinicians, doctors and nurses at the bedside, a sort of an early warning system for children that may be in trouble that would not be obvious looking at just the vital signs. So it's really, really taking vital signs to a different level in terms of doing analytics. The second big area is medical imaging and diagnostics, including electrocardiograms. This is, I don't have time to elucidate the AI for medical images, but suffice to say, it's something called CNN, or convoluted neural networks. It's simply mimicking the human visual cortex and deconstructing a medical image into hundreds of different layers. And that's why it is sometimes better than a human pair of eyes looking at a medical image. It's very, very systematic, very thorough, very detailed. And I think this is how the radiology department at Stanford now is looking at some of the x-rays with the use of heat maps and artificial intelligence. And this is what AI in an operating room could look like, not just in the future, but in some centers now. So surgeons look at a, oh, you might have to play it for me. So the first half of this video is the same as you would see normally. So a sample from a biopsy is taken, prepared. But what's interesting is the second half of the video is entirely not what you typically see in the operating room. So normally you would prepare the sample and you would send it to pathology, and you may or may not get it back that day, but usually it takes hours to days to get a sample back. This is now using the sample and putting it into a software, artificial intelligence-driven software, to basically make the diagnosis in a matter of minutes, 120 seconds to be exact. So this is almost real time, looking at the image being acquired and the diagnostic prediction in terms of what the tissue is showing, what % chance this is a certain tissue, and whether or not they need to go back and get more tissue. So you can see in real time, this image is being interpreted with artificial intelligence and really guiding the surgeons in terms of what to do in the operating room. So this is, I think a decade ago we would have thought that was science fiction, but science fiction is already here. Precision medicine, and just relating back to my coronavirus story, I think with artificial intelligence in the near future, we all have a phone. And I think in the future, we'll be using the advantage of having technology in our hands to basically deliver precision care that we all like to see at someday. As you may have heard in the last few weeks and months, the first antibiotic that was entirely derived by artificial intelligence is here. It just came out a week ago. I heard on the news on the way in on NPR that part of the frustration with COVID-19 is going to take months to come up with a vaccine when the epidemic is already under control, and in the future we'll have the vaccine in a matter of hours, not months that we have now. So you'll start to see the timescale of healthcare and medical interventions in terms of months and years changing to hours and days, which is what we need. Is that a real 2 minutes or the 2 minutes that other people have?
Real 2 minutes.
Okay. I noticed it's always the humans that get in the way of an artificial intelligence talk.
It's augmented AI.
It's augmented AI, okay. So what you'll see is different planes of data and information collated into a meaningful assemblage of information and wisdom to practice precision medicine in the future. So I thought this was interesting in terms of modern technology. In the same restroom, two different aspects of technology were juxtaposed. So SQ is status quo, if you're wondering. So without creeping people out, I stood in the corner of the restroom and just see what, I'm a data scientist, I have to collect data. And the first 9 humans used SQ and didn't want to really touch AI either. They're not familiar with it, or they're just not comfortable with new technology. So lesson there. So I think this coming decade.
Did you get arrested?
I'm sorry, no, I didn't get arrested, no. I think this decade will have the transition from hype and hope exceeding capability. I think we're going to match the capability towards the end of this decade. So a couple of things in the future. I have 2 wearable devices and a portable device on me, although you can't tell. I think in the future we'll have a lot more wearable technology that's going to be coupled to artificial intelligence. I think clinical training education will be entirely driven by extended reality with the help of AI. And this is how a future surgeon is going to get trained.
The scope is in the perfect place. I think it's best to make your incision right here. Here is the minor fissure. Here is the front of the major fissure. I would start right here and unroof the cyst. Follow this plane right here. The superior segment artery should be near there.
Okay. In the future, I'll also be a female voice. So, a few takeaways. I think, believe it or not, if we think healthcare is complicated now, it's going to get I think it's going to be far more complicated. But But the good news is that I think coupled with AI, it's going to get faster and more accurate. Think of AI as a multidimensional resource to help you solve problems. So I think more important than technology is we need to change the culture in a hospital and health system. So overall number of humans in healthcare, I think, will increase, but those who know or appreciate AI will have an advantage for sure. And just a few references. So I want to thank Children's Hospital Orange County and MI3 and my donor, as well as my very patient mentors at Stanford when I was in school. These are the top 3 books in the last 3 years, particularly the last one. I think the last one should be required reading for all healthcare leaders. It really talks about not just AI, but everything that the other speakers talked about in terms of digital transformation and how do you navigate in that modern system. And if you're interested in more AI in medicine, I'm literally turning in the proofs for a book that will be out in March on this topic called Intelligence-Based Medicine. And notice I didn't name it just Artificial Intelligence in Medicine, because I think human cognition is going to have a significant role in the next decade or two. And a lot of the talks from previous meetings are updated. And our big meeting, we had about 600 healthcare stakeholders at the meeting, including payers, providers, and patients. We have an annual meeting, and it's right down the Pacific Coast Highway at the Ritz-Carlton, and hope to see some of you there this December. Thank you very much.